Welcome. My name is Peter Strong, and I provide online mindfulness-based therapy for overcoming anxiety and depression without using drugs. So drugs may have a usefulness in extreme circumstances for managing symptoms. But of course, that's all that drugs are able to do. They do not treat the underlying cause of your anxiety or depression or OCD or any other psychological problem. The underlying cause for anxiety and depression is psychological. It's the result of certain unconscious habits that have become established. These habits are triggered by various factors, maybe internal factors like thoughts and memories. It can be external factors such as in a phobia, for example, around driving. So the external sight of a highway or being stuck at a cross-section, a red light, can be a trigger that triggers this underlying habit that creates the anxiety or panic attack. So this is what online mindfulness therapy is trying to address. It's how to help you change those underlying habits that cause your anxiety or depression. We don't want to just ignore those habits by medication because that will not help them, and they typically will simply get stronger over time because they're not being addressed. So we do not recommend medications. We would much prefer to actually get to the root cause of your emotional suffering and help you change things there. And we do this in mindfulness therapy by actually developing conscious awareness, that's mindfulness, around these habits, because typically the habits simply become unconscious. They become reactive, they become conditioned, and they operate out of consciousness. So the first step must be to bring consciousness back, to see those habits very clearly, to be able to identify the triggers, whether that's internal thoughts or memories, maybe traumatic memories, or whether it's external triggers. We have to really understand that part of it, and then we need to focus on what exactly happens in the mind when you are exposed to one of these triggers. So we might choose to meditate on particular thoughts or beliefs or traumatic memories in order to see what the mind does, how it reacts, what that habit actually is. And the more consciousness you bring to the habit, the less power the habit will have. So that's the whole purpose of consciousness. That's why it has evolved in the human mind, because it allows us to override habits. And that has a tremendous survival value for humankind as a species. But when we're working with anxiety and depression, we want to look at these habits carefully. We want to identify the reactive thoughts that get triggered, because those reactive thoughts have the effect of feeding and reinforcing the underlying habits. Rumination is a major factor in depression and also in anxiety. This tendency to become obsessed with habitual reactive thinking is the main source of energy that fuels anxiety and depression. So we need to see those thoughts and not just become blindly identified with them. we not become lost in those thoughts. We need to see them clearly and then retrain the mind to be able to see the thoughts clearly but without identifying with them. So this is called basically mindfulness-based therapy to overcome reactive identification. So reactive identification is the most important process that goes on in a habit formation. It's where you become lost in the stream of reactive thinking or secondary emotional reactivity as well. We tend to get lost in the mind, and that simply reinforces the habit. So we learn to sit with these emotions and with the thoughts that are triggered and not become lost in them, not become overwhelmed. So this is a training process, and mindfulness meditation is fundamentally a training process, retraining yourself on how to relate to your thoughts and emotions and memories without becoming identified. The second part of our mindfulness meditation process for healing anxiety and depression is to look at the internal structure of your emotions. And that internal structure is almost always based around imagery. Internal psychological imagery is the primary organizing force, if you like, that keeps anxiety or depression in place. The reactive thoughts, they feed the anxiety, but the anxiety itself is maintained through internal imagery. So we look at this imagery, we look at what color your anxiety or depression is. Color is part of its imagery. We look at how large it is. Obviously, if the imagery is very large, then the emotion is going to be very powerful. We look at the position of the emotion, the psychological imagery of your emotion. If it's high in your visual field, then it will have more power than if it's in a low position. So these are some of the factors, some of the simple parts of the imagery of emotions that we look at and examine when we are meditating on our emotions, and really seeing how they work. When you see more of the imagery, then of course you can experiment with changing that imagery. And the golden rule here is that when you change the imagery, you change the emotion. They are directly related. So this is how emotions heal. They will have to undergo some form of image transformation or reprocessing in order to fully heal, for the emotional content to really change. So we basically speed up this process by really examining that imagery in detail and then exploring in great detail how to change the imagery and find what it is that helps the imagery and the emotion resolve itself and heal. So you could really make a simple statement here that the real cause of anxiety and depression is imagery that has not changed. It remains stuck, frozen in time, and we need to change that imagery. We need to come back and reprocess it in order to overcome emotional suffering. In the case of PTSD, this is a very dominant primary process here, because those traumatic memories are what causes your trauma when you re-experience that situation. The anxiety and depression result from that re-traumatization. But the trauma itself, the emotional distress, is caused by the image itself. The flashback image, generally, again, you'll see that traumatic image is too large, too close, probably too high in your visual field. You may see it at head level or above you or directly in front of you, and it will have very intense colors. These are what actually causes the trauma. So when we work with PTSD, we look for this imagery, this memory imagery in this case, and we basically reprocess it. We change that imagery. We find how we can change it in a direction that basically neutralizes that re-traumatization. One classic way we do that is to miniaturize the image. So just make it extremely small in size. And when you do that, you often will find it will take away 90% of the intensity of the memory image itself. So working with imagery is extremely important. It's a fundamental part of mindfulness-based psychology and psychotherapy. If you would like to learn more about online mindfulness-based therapy for overcoming anxiety and depression and OCD, and also for working with PTSD, then please do contact me and let's schedule a Skype therapy session. So I offer therapy via Skype worldwide. All you need is an internet connection, and we can schedule our Skype therapy sessions. Skype therapy is very effective in general because you can see each other. It's many times more effective than chat-based therapy or email therapy because those don't have this visual component. If you use Skype and you can see each other, there is really no difference whatsoever in the effectiveness of online therapy compared to meeting a therapist in person. And in many cases, I would argue from experience that Skype therapy can be more effective because it's much more comfortable for you. It's less intimidating. It has less of that clinical feel to it, which is not good because it makes you feel like a victim, and that's not going to help the process of recovery. So, especially if you're suffering from an anxiety disorder, Skype therapy is a very good choice for you to consider. So please contact me if you'd like to get started with me. Most of my clients see results in a very short time. Often after 3 or 4 sessions, people see and experience big changes in the intensity of their anxiety and depression. They feel much more empowered, much more able to do things that they weren't able to do before. They feel more in control. That's the whole aim here, is to restore that sense of being in control of your happiness and well-being. So please contact me if you're interested in mindfulness-based therapy via Skype. Thank you.